ago, we talked about, a couple of years ago, we talked about when do we think COVID would be over? And I think we came up with some litmus tests like um, when COVID, when we had a cure for it. Well, we don't have a cure for COVID. I mean, there's nothing, we have treatments, but where there's nothing that a cure is when you can take a medication and it eliminates the virus or the disease from your body. So we don't have a cure for it. Do we have effective treatments for it? We do at this point. I mean, if you consider Paxlovid an effective treatment, maybe. Um, but we know that people are not dying at the rates that they were at the height of the pandemic. But the rates for death have not gone to pre-pandemic levels. So we're still not there. Um, and then lastly, have people return to pretty much their normative? Have we made an adjustment and we've gone back to our normal, whatever, pre-pandemic social activity, social life? I think that has happened for the most part in terms of social life, but we're still seeing some ramifications from COVID in terms of increased people with drug abuse, with uh, folks' marital disruptions. You know, we've been talking a bit about what's been happening with our children now that they're, you know, we're seeing increased issues around mental health. So there has been some sequelae, even though we've kind of returned to our pre-pandemic level of activity. Certainly in terms of travel and in terms of um, uh, some of the things, like there's no more lockdowns, and some of the things that social activities that got stopped, we're back to that. I think the churches are still saying that their level of attendance has not reached pre-pandemic attendance levels yet. So we're not completely all the way back. But the question still remains, is COVID still a pandemic? So, you know, fast forward to 2024, we know that worldwide, the virus has taken an estimated 7 million lives. It's still mutating and sparking new variants. It's still sickening thousands of people and ultimately still killing hundreds every day. We just don't talk about it every day. We're not even seeing the updates so much from like the Washington Post or from the CDC. We also had far more tools to address COVID than we did in 2020. So all of us have learned about, you know, using ionizers or Clean Smart or making sure that we have air purifiers in our homes, and we certainly, you know how to take care of ourselves when we're in crowded spaces, and we're just being a lot more careful. But the other tools that we also are learning, and it's also about how we can take care of our bodies better so that our bodies can withstand any viral assault that comes our way. So we're just we're working on being healthier as we go through and live our lives. And I know that, and we still recognize that that if you're over 60 years old, that you're in that more vulnerable population. So with all that in mind, is COVID-19 still considered a pandemic level threat? Well, the word pandemic is not binary. It's not like it's on or off. And to make it even more challenging, there's no one agreed upon definition of the term pandemic. Um, so actually the mailman, and I know Joshua Mailman, his family has started Columbia's Mailman School of Public Health. And they says a pandemic begins when this disease is spreading exponentially and across international borders. This wide geographical reach is what makes pandemics lead to large-scale social disruption, economic loss, and general hardship. So we know we've been through a pandemic, but we doesn't seem like we're back at that place now. On the other hand, a disease is endemic when it is consistently present but limited to a particular region. Well, you know, at this point, it's endemic, but it's endemic across the globe. It's not just endemic to, like, say, the North American continent or just a specific area, a couple of countries in Africa, or something like that. So now it's just a part of our biome. It is a part of the world. It's biome, not just any particular region of the world. So it's been consistently present for several years. So Dr. Rowland would probably say that it is, and he had predicted that we're not going to be able to vaccinate our way out of this, that eventually the virus was going to become endemic, so to speak. So while nobody while no one, and especially WHO, has not made a ruling that the pandemic is over, they have said that that the virus still remains a global health threat. There are hundreds of thousands of people with COVID-19 in the hospital right now, and there are many suffering from long COVID. What we can say for COVID-19 is that the crisis is over, but the threat is not. And what we need now is for countries to pursue their response and to take action needed to save lives. So on that front, we are looking at, I want to go and share my screen because there is a new variant that's out. And remember, we have talked about this, that no matter what variant comes around, as long as we know the 7 F's and an R, we will know how to protect ourselves. So we're not going to get, oh, okay, I think my screen share is on. Okay, here we go. Okay. So no matter what variant is here, as long as we know the 7 F's and an R, we can always protect ourselves from a virus. So the new one that's out now is called Flirt, cute name, otherwise known as KP2. And what makes it significant is that, well, first of all of the viruses that you see were all Omicron babies. So, before, we had Alpha and we had Omega, we had all the different variations, the different Greek letters. But these are all Omicron babies. So they all came from the same branch, basically. So when Omicron started and, EG5, XBB, remember, we haven't talked about these in a long time. It's been almost, I don't know, when's the last time we talked about XBB? Maybe a year ago?
Oh my God, last year?
Yeah, I think it's been perhaps a good year.
Mm-hmm.
Okay. So basically, everything that's has come out from, they were all Omicron babies. But what's significant about KP2 Flirt is that the rate of growth has been astronomical, because it's at the end of March, JN1 was like the majority of cases. And now here it is, not quite the end of May, and KP2 has taken over and is now like 30% of the infection. So some of the concerns is that it's just the rate of growth. And if you think about, like, any of us got vaccinations or whatever, most of our vaccinations were based upon, probably not on the Omicron series. At least I haven't gotten one. I think mine was on the prior um whatever, the prior Greek letter. uh, one of the prior Greek
It
letters.
wasn't the Delta though.
It might have been. I said I have to look at the date on my vaccine because it was. I haven't gotten a new vaccine in at least I would say 2022.
Yeah, me too.
Um, I would take a look.
Hmm. Could have
So
been
I know I
Delta.
have, so I know I have not had an Omicron based vaccine, and I know we were looking for Novacide, not a Novavax,
Novavax. Hmm.
to come back because. So what makes this concerning is that if you're over 60, if you're older, if you're immunocompromised in some way, then it might be time to take a look at updating your vaccine if that's the route you want to go. Um, um, Particularly since this one has a new variation in the spike protein, and they will probably be in the fall. They will probably be making a vaccine that's based upon KP2, as opposed to the older ones, which were based on XBB, and which, and those are long gone. I mean, you can see that they're down to zero. So I believe the last set of vaccines was actually made on based on the XBB. So, you know, uh, so this is where we're at in terms of the variants and what's going on. They're saying that it's not as virulent. There's no reason to think that it is going to be more harmful or more deadly or hurtful or make us more infectious. Well, infectious, yes. They said it is more infectious. And I don't think they're even telling us like, because usually they would tell us I forgot what they called that, the R number, like measles was 10, and
Yeah, the
I
R
don't even
naught.
think,
Hmm.
yeah,
The
the R
R
naught.
naught. Hmm.
Yeah, I don't even think that they're doing that anymore. It's like, okay, it's just more infectious than measles. Okay. Um, and the concern that they're expressing now is, will there be a summer surge? Because we know that the COVID flu has not been like seasonal in the way that other flus have been. Because typically there's a flu season between November and April. But COVID has been one of those flus that actually is not based on weather or seasons, but probably more based on movement of people, so to speak.
Hmm.
So yeah, so they've not talked about it being more uh, serious in terms of sick, how sick it makes you, or or if it's more deadly, but they have said it is more infectious.
Hmm.
Um, they first detected this one, flirt KP2, in the wastewater in Las Vegas, actually. So they're still monitoring wastewater to determine, yeah. And remember, Dr. Rowland said that that's eventually where they're going to go to. That's how you can tell when that was one of the ways you could tell if the pandemic was over, when it's no longer in the wastewater. So it's still in the wastewater. They're still monitoring it, but they're not necessarily sharing that data very freely. I mean, it's not like it's something that you can just go. I mean, you can search, you can find it, but you really have to search for it. Yeah, really search for it. Um, so it's not gone. COVID is not gone. But I'm just grateful that that we have long been practicing our biosafety protocols, and have gotten very proficient at doing that. And I'm just hoping that people are not getting lax about using them. I still travel. We were on the train. Um, We did a train trip to Ogden, Utah. I still had, I had my ionizer on, my skin guard. Um, I had my Iron Me. I have, I still use everything that I need to use in order to stay safe. And I hope that you all are doing the same. So there is some thought that perhaps with Omicron, that the virus has evolved in such a way that it doesn't kill the host, because maybe it's smart enough to realize that if it killed its host, it would die too. But we're all learning. We're learning how a virus evolves and what kind of because I think at one point Dr. Rowland has students, does a virus have a brain and can it think? You know, I don't know that it has a brain or that it thinks, but it struggles to survive and thrive too. And if it has whatever it needs in order to figure out how to still live and live on its host. So how that happens, if I ever figure that out, I'd get a Nobel Science Prize. But it has done that. So what does that mean for us in this group? Well, we need to continue to protect ourselves, our families, our friends. Um, uh, while we know that COVID has progressively evolved to becoming a more infectious disease in order to boost spread and replication and mutation to evade the immune system, it probably recognizes there's no advantage to killing their host. Ending the emergency designation doesn't mean that the COVID threat is gone and that our situation is benign without consequence. Serious disease continues and people are still dying of COVID. The CDC reports that for most of 2024, between 1,000 and 2,500 people have died weekly. Surges will undoubtedly continue with the seasons and with new variants that emerge. So that is still, we're seeing that those numbers still would make it the rate of death higher than, I think the worst flu death range was like 45,000 prior to COVID, and that was in the worst year. So we know that the death rate for flus of all sorts is still higher than pre-COVID levels. So COVID is still here. It is added. It's still here. It's still here. We have not reached pre-COVID numbers, which means that we're still going to see an impact on longevity. We're still going to see an impact on quality of health, because we know that as people get COVID, the more people that get COVID and the more times people get COVID, the more the possibility is that they will get long COVID or have some sort of long-term impact as a result of getting COVID. So remember, this is an unusual virus which can cause long COVID, especially in the unvaccinated or in those with repeated infections. So for those, so most of us know that, and I think, our group has done a good job of trying to make sure that we don't get COVID over and over and over again. I know people who have gotten COVID 2 or 3, 4 times in 1 year. I think that I've had it once and I'm trying to make sure that I don't get it again, ever. But I think that every year that I can go without getting COVID, so far I've gone, let's see where I'm at now, 2 years, 2 years, or is it three? Might be three. no, 2 years without having gotten COVID. So we know that your body is able to repair, regenerate, rebuild itself. So the longer you can go between episodes, the better it is for your health, your overall health. Um, I don't make recommendations about, I'm not a physician, so I don't make recommendations regarding taking the vaccine or not. I think that's a individual um, concern or individual uh, uh, something that you need to decide for yourself and what it is that you need to do for yourself. I don't know anybody's specific medical condition well enough to make any kind of global recommendation other than, globally, we've talked about taking Pneumovax 23 and we've talked about getting as healthy as you possibly can. And perhaps I know personally, I'm waiting to see what Novavax is going to do with this new flirt variation to see if that's going to be updated. Um, I'm just particularly leery about the mRNA simply because it's a big experiment, and we know that that's a big experiment. Um, yeah, I am over 65. I'm 67, so I know I have to be particularly careful. And my husband is over. He's 68 and has had a stroke and has blood clotting issues. So I want to be careful about um, vaccinations and what might happen as a result. But we do need to be either, you know, I can't speak for anybody else, but I know that in my family we are very diligent about um, doing the COVID protocols. It took a while. As I mentioned before, my husband's had some short-term memory issues, but when it comes to the COVID protocols, he's on it. He's 100%. He's doing it. So I think that that's the thing that saves us the most. We do know that COVID is one of the respiratory illnesses that is pretty particularly dangerous especially for older people and for people who are immunocompromised. So we need to make sure that we try not to get it as much as possible. So do what you need to do because we don't want, persistent long-term COVID issues, and we want to continue to thrive and not just survive. How you doing, Michelle? Uh,
I'm doing good, Dr. Busman. It was just interesting that, well, Mrs. McNair said long COVID.
oh, dang, I lost all my little, I
Yeah,
had a bunch of,
he made a comment. Biden made a comment. I think it was last week. My husband heard him say something about a second pandemic, and so I didn't have a chance to look into it. And I just was pulling some stuff up on my phone, and they defined long COVID as the second pandemic.
As the second pandemic.
pandemic, right?
Mm-hmm.
Right.
Mm-hmm.
Absolutely.
I think we
Uh,
had that. I think we kind of ventured out that way when we did a video.
Yes,
We kind
that,
of touched on that.
that was that video from Dr. Campbell.
Yes.
Mm-hmm.
Mm-hmm. Because, okay, I don't know. Well, not in a loop no more. Maybe this is a good opportunity for me to just start uh scrubbing policy because Medicare has a 10-year rule, right? But recently I found out they're only doing or paying for one major blood panel a year when they used
right.
to cover 3 times a year, maybe.
No, they cover one. They don't cover three, and they need to cover three.
They need to cover 3. Okay, but is it is that new?
to
I'm not
cover
sure.
3? I'm not sure
So
what.
I thought when my mom came back from well, I can't call it an annual visit because it's the middle of the year. So it's her every 3 month visit.
Does she have every 3 months?
Yes,
Okay,
she
once a
has one
quarter.
every 3 months. Yeah, so she has a quarterly visits.
Okay.
But the primary could not bill for another panel. So he's finding things that he could do that Medicare will cover, because Medicare won't cover another blood draw, only one a year.
Mm.
So he did a urine sample. He just anything to get a lab,
Mm-hmm.
because gerontology, right? So chronic conditions.
Does she have a chronic condition which would?
Well, 2 chronic conditions, right? BMI, high blood pressure, probably 3, hyperlipidemia.
Okay,
And I don't know if he has her in a chronic care condition program.
got you. Because
So,
I don't have any chronic illnesses, and they only pay for one for me.
yeah, that's the only one they'll pay for, right? Yeah, they're not
Right.
they're not going to pay for more than one.
For
Okay,
me.
so right, so we have a protocol for we have a suggested protocol that if you become ill from COVID, that you should have your blood drawn. Oh, my hand is itching. Thank God for a little coin.
Mm.
That you should have, that you should
But you
have
should
a
have your
right, right. So you then,
uh right.
yes, Sister Shirley.
Yes, ma'am.
Sister Shirley.
Yes,
Mhm.
ma'am.
Well, Sister Shirley was the one that alerted us to
Right,
that once you get COVID, you should have your blood drawn more frequently to see what your blood or how it has changed, especially
right,
if you had it drawn before COVID, because there was some people becoming like pre-diabetic after COVID, or
right.
their blood work changed in some significant ways that
Mhm.
would suggest the onset of or preconditions to some kind of chronic disorder. And if you catch it, if you saw it in the blood work, you could catch it in early and try to keep it from becoming a more chronic disease if you check the blood work sooner rather than later.
Mm. So I can just say that I'm not familiar with the stipulations that you guys are talking about, because
Mhm.
my rheumatologist, my cardiologist, and my endocrinologist has 1 year of labs
Mhm.
in the system.
Mhm.
So, for instance, I know I'm seeing my rheumatologist coming up tomorrow. So I went in Friday to get my labs done,
Mhm.
but I also just had them done a month ago.
Mhm.
And the insurance company has never denied paying them.
Are
So
you
I
an
don't know.
MAPD or a straight?
What, say that again?
Are you in an MAPD or a straight Medicare?
So I am United Healthcare Advantage
Mhm.
PPO.
Mm-hmm.
Okay.
And it could, and I believe it's has a lot to do with
Right.
uh diagnosis,
Mhm.
uh or my diseases, or maybe the place where I'm going, which is Northwestern, they don't hold to that regiment, because I go now, if not every other month,
Mhm.
I go once a month.
Mhm.
So I get my metabolic panel done, I get my lipid panel done, I get my
TSH for my thyroid
Mm-hmm.
levels.
Mm-hmm.
And I get my C-reactive protein, my set rate, which tells how much information I have in my system.
Mm-hmm.
And I get them done like clockwork. So when I go to the lab, all I have to say is pull up the lab requests for these doctors' names, and they just automatically draw my blood.
Yay.
So, but I'm heavily being monitored myself, because of the long COVID and all the other stuff that I had going on. But I didn't just do it for long COVID because I just saw the pulmonologist and the neurologist.
Mm-hmm.
There's not really any labs that I can recall that facilitated that activity. So it was more cognitive, uh, and that lab breathing test that I took.
Mm-hmm.
So when you went to okay, well, let me get the clarity. Did you ever go to a long
Thought
haul?
you did.
Yes,
Yeah,
yes,
you
I
did.
did. Yes, I did. I was evaluated by, so what I did is I got on Methodist, not Methodist, I keep saying Methodist, that's Houston. I got on Northwestern's site and I went to Colbic, and then I went to Long Haul Colbic Clinic.
Mm-hmm.
And then they had a criteria there that gave me an idea of what was happening with me. And so for me, I noticed the brain fog and the slight memory. And then I was also having some cramps in my leg. So then when I went through the clinic and was processed, then I saw the neurologist, the pulmonologist, and then they referred me to Shirley Ryant, which is where I went to do my treatments.
Mm. Did you have to pay with insurance? Did they ask you for an insurance card?
They did, but it was just a typical office visit.
Mm-hmm.
I wasn't really sure if it was even coming out of the same pot as a typical hospital scenario. But I didn't pay for any medications. I didn't pay for any doctor's visits, and I had physical therapy, and then I had the cognitive um, exams 2 times a week, um, a lot of evaluations, a lot of puzzles, a lot of asking me questions to check and see what I could um, remember or regurgitate back. And so that was kind of it. Now I can tell you now what I have noticed is I've noticed a lot more peripheral things going on. So I've had the sciatic nerve, I've had the plantar fasciitis, I've had the cramps in my legs, which they thought it was blood clots. And it was none of that. Then I started this severe violent body itch. And now they're saying to me as of last week that they think now all of this has been associated with the long COVID and or the vaccines. So that's kind of where I am. So I just found out last week that the violent itching that I have been experienced that goes and comes is they did some biopsies and they sent them to Johns Hopkins because they're looking at possible small fiber neuropathy. They've already checked me for peripheral neuropathy. So that's when your muscles and your tissues are starting to target you. So I was much healthier until I got the long COVID. It's been like ongoing. So
So Sister Shirley, you have like you've changed your whole eating, drinking, you know, and I know you have, well, from just previous conversations, you were saying how you were feeling better with certain foods. I think you were eating your, which I still need to research that because it's so interesting. Eating for your blood type.
yeah.
Yes. Okay. Yeah. I'm like, yeah, I really want to look into that for myself. So how are you getting better with the food? How is that working?
So here's what I do know. I do know that since I changed my diet, so I'm a little bit more guarded with what I eat. So I do make food choices based on what my blood type choice tells me is more beneficiary versus what it says avoid. So even though some things like avocado is perceived to be wonderful uh, for protein and other nutritional value, my blood type tells me to avoid it.
Okay.
And so as a result, because I am avoiding the things that it's telling me to avoid, the same thing when I was doing the juicing, the arugula and the spinach fell within the categories of neutral. What was beneficiary was the chard, the collard greens, the mustard greens, the broccoli. So that was the reason why I immediately switched over to that. Because when I started out, I was starting to get the itching again. So I did not know what was facilitating it. So I just started eliminating some things and going to what it was telling me was beneficiary. So what's happening now is I could not walk. I have not been able to go like on the lakefront and walk because of the sciatic nerve and my foot, my plantar fasciitis. But now, since I've juiced, I'm able to do 10,000 steps a day.
Right.
So I'm just wanting to believe that played a significant role in me coming back physically. Right. But, I still got the thyroid issue, so my thyroids were removed because I had 9 nodules on them. And so they had no choice but to take them out. So the thyroid is the thermostat in your body. So that, if not regulated properly, that causes a whole load of other issues. So, my physicals are showing that my thyroids are being controlled, my blood pressure is being controlled, my rheumatoid arthritis is better controlled. And so overall, I'm doing better. Now, what I'm challenging now is because I have metabolic syndrome, which affects my metabolism. Then I don't sweat like most people do. So that causes me not to lose weight as fast.
Oh, okay. Okay.
So, listen, I say to myself all the time, getting old is not for wimps, okay? Because this is the ongoing thing. But you know what? I'm so blessed to be 72 years old and still be here and walking. And because there's so many people around me that I love, that are best friends, that are not here. So I tend not to complain. I tend not to be negative. I just tend to stay on course because I know my personality. I'm going to fight for me until I have no more breath.
Hello. Hello.
I'm
That's
just trying to be more accountable
yes.
for my behaviors.
Mhm.
And, the hard things for me is sugar,
Mhm.
cookies, a little cake here and there. But, nothing is a little for me. I get one chocolate, then I got to go back and get two more,
Hey, you sound like me, sister. Let me get 2 more cookies.
And then the next day, I'm suffering the consequences, but I'm learning to be more disciplined.
Good.
Um, that's all I can say.
There's always a lesson to learn. Sister Shirley, I know that we're going to lose your presence, and you are so freely open with your challenges, right? Like we who can we talk to, or who can share, what happened with contracting COVID. And
Well, you know what's really interesting? So the lady who I invited to my home, y'all know my story,
yes,
and she gave me COVID,
yeah, yep.
and then she relocated to Houston.
Mhm.
So because I am trying to uh, walk differently and be more forgiving and give more grace because I want grace, right?
Mhm.
So we were able to have a real candid conversation
Mhm.
and resolve our differences. However, she lives in Houston, Texas now.
Mhm.
She called me last week, or should I say, she left me a message, and she said that she had COVID, and she was on her way to her son's wedding. It was on one of the islands. So she had gotten Paxlovid, and she was doing good. Now, what I do know, because I'm still studying COVID all the time and the immune system, because that kind of stuff kind of intrigues me, is you can't continue to put these viruses, bacteria, infections, whatever you want to call them, in your body and think that you're not going to have any long-term problems.
Mhm.
Right.
I mean, it's just our bodies are just too delicate to sustain that kind of abuse and those kind of attacks. And she sounded very sick. She had had it for a couple of weeks. And I'm sure she went on down to the funeral, masked up, didn't say anything to anybody. You know what I'm saying? So what I learned from that is people's behaviors does not change until they want it to,
Mhm.
because obviously she felt that she needed to be there, COVID and all, right?
Mm.
So
If I
That's
may say, that's very selfish of her.
absolutely it is. Absolutely it is. But I just believe that some people have minimized this whole arena as just a flu, as just a minor cold.
But look what it did to you. That's the same person that infected you.
And I
correct.
infected other people.
Not
Okay.
know. But you didn't know it.
Um,
You were unintentionally, you didn't intentionally do that.
but here's the
No,
thing. Out of all of the people in that circle, I was the sickest.
mm.
So I could have very easily lost my life. And I think that that's what happened in the circle of us infecting each other, affecting our parents or affecting someone else. You don't know if you're going to be that person to live or die.
That's right.
So all you can do is do better and not try and pass it on. But everybody doesn't feel the way we feel. I think that that's the reason that we're all a family and we're all here trying to do the best that we can do. But that's not the way everybody feels.
No, it's not.
Mm.
My cousin, so my aunt just had COVID 2 days ago, and she's all of 79. She had to check herself into the hospital. Um, she didn't come to the event, but we had an event. We had a family event in Atlanta Sunday. I'm the only one that had on that air tamer.
Mm-hmm.
Not your mom?
She left it in the car. Now she did put her mask on, when just visions, then she put her right.
Sister. Okay.
But
Because usually she's on it. Usually.
you try to be an example. I mean, my mom okay, so we really just sent our uh senior guys out to the family because we missed the first wave with Christmas and New Year, so it came good with Mother's Day and Father's Day is coming up, so we got a few more that we can send out. But I just, and it was older women there, and close to their 80s and 84 on dialysis.
Ooh, oh, that's
And
not good.
all the grandchildren and all the children and everybody. So we have a variant that's moving fast, right? Like this
Right.
thing, no one is talking about this variant that's moving fast because the variant is moving fast. And we don't know how many people are succumbing to it because they're not talking about it. I mean, it's just, I feel like we're in so to answer the question, yes, we still are in a pandemic, even though people are not taking it seriously at all. Um, so I
Mm.
even woke up not feeling too good on Saturday. Took my temperature, it was a little spike, not much, but the weather's changing, and I'm not getting any fresh air in my room. So I think I got too much dirt and stuff in my house. I need to really clean it up because I think that's what's really going on with me. But I don't, I'm flabbergasted. I don't even know what to say to the state of mind that people are in. Like we're not taking this thing serious at all. Um,
So I'll say to you that the good things that have come out for me is I do wear my tamer
mhm,
everywhere, number
mhm.
one.
Yep.
Yep.
Number two, I have my skin guard with me everywhere, even if I have to stuff it in my bra, excuse me, men, but I got to make sure I have my stuff with me. The
Mm-hmm.
third thing is I have four um air purifiers
Mm,
in my house and they never ever go off.
mm.
Never go off. And it does help because it eliminates the dust. You don't have to
Yeah,
dust as much.
that's what I need to tell. That's what I need to buy some more air filters, air purifiers.
Yeah, but I think that it does kind of scrub the air, if you
Mhm.
will. And it eliminates allergies and allergen and
Yeah, and I know I got them in here.
yeah. So that's the plus of that. Right now, I'm just trying to get the vitamin D and the fresh air and trying to make things come through my pores, drinking a lot of water. And I have degenerative lower lombard
Mhm.
and I have degenerative cervical. And so I've worked through the pain and now I'm feeling better just by walking.
Good.
So
That's good. That's
I
good, Sister Shirley.
got to keep moving.
Yep, you got it. If it wasn't for the fact that we just have to continuously keep moving, right?
Yeah.
And I'm gonna say this collectively, that we just have to continue to move. I remember the story. Um, I think we were just COVID. We were a community when this happened. Dr. Westman, I don't know. I think my mother told me this story. The lady caught COVID and she was taking care of her grandson. She was sick. She was down. And she saw her life leaving.
Lordy.
And the grandson went to her and said, if you die, what happens to me? And she fought back. She fought back and came back for her grandson because he didn't have nobody but her. I think that says a lot about the human spirit, because we don't have a lot of information. We didn't have a lot of information in the beginning. We got information um, from Dr. Rowland, from each other, from our research. And we have been ahead of the game for years. And we still don't have a lot of information. Miss Belvedere, is that you? Yes, ma'am. I see your hand.
Yes, ma'am. I just wanted to make a suggestion to everyone, especially you, Doc Miller. You was talking about dust, and Miss Shirley was talking about dust and her purifiers. The snake plant is a natural air purifier. Are you familiar with that?
The who?
The snake plant.
Really?
Yes, it is. You could Google it.
Okay.
Please Google it. And I suggest
What
you put a nice big one in your bedroom and throughout the house because it does something during the day, but at night it releases oxygen.
Great. Yes, I need it because I know these I'm not getting any air.
Is snake is Snake snake?
Yeah,
Yeah,
I'm looking at it now. I think I thought we called it mother-in-law tongues.
yeah, they have several little nicknames for it, but
Mhm.
it's that same snake plant. I never liked that,
Mhm.
but it does it has a lot of little benefits that we really need today more than we needed yesterday.
Okay.
Mhm.
Oh, yes, I'll go get this.
I
Oh, I
will
didn't
give you.
know that. Okay.
Is someone reading it from Google or somewhere?
Yeah,
Uh-huh.
very low maintenance. I have one in my
Help to
house.
filter the indoor air. Yep. It can convert carbon dioxide into oxygen at night.
I need that.
Isn't that incredible?
It is.
Is their ability to remove toxic air pollutants.
Mm-hmm.
So it can absorb cancer-causing pollutants, including CO2, benzene, formaldehyde, xylene, and toluene.
Wow.
Uh,
So Miss Belvedere, when you gonna lead a community night?
What
I'm
does it
sorry.
mean?
Yes.
Yes, when you gonna facilitate?
Oh no, I don't think I'm capable of that. I just have my little quirky things that I've been doing all my life. And I noticed when you were talking and you felt stuffy, and then you really admitted that your bedroom is stuffy. And a snake plant would do good for you.
Oh yeah, I normally have my windows open, but it's summertime, so you got the air conditioning, coming through the filter.
Natural,
Oh,
yeah, it's a
Mhm.
natural air purifier.
yeah,
And I
that
need
snake
something
plant.
because at night it just started happening, so I know it's because I don't have the windows open. I don't have the fresh air coming in like I do, you know.
But when the temperature goes down at night, you can still open your window and get
I
fresh.
do.
'Cause I do.
I do, but my little place holds a lot of heat, even though it's kind of weird. But it's just this old apartment building. It's not, there's no rhyme or reason to it, Miss Belvedere, but I am going to get one of these snake plants because my sinuses are jacked up. um, and I normally shampoo my carpet twice a month.
Really?
Uh-huh. Because we live in an apartment complex,
Mm-hmm.
and as much as I want to take the shoes off at the door, I do, but it 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 it
Not
still
enough.
doesn't matter really. And then I got my dog. So, I keep the carpet clean. I have not had a chance to clean the carpet in a month. And so since I ain't got no job, that's what I'm gonna do in the morning.
Oh,
start,
yeah.
start cleaning my carpet. But yeah, but see, little things like this is what's important. It in the little information, Miss Belvedere, is
Yes.
huge.
Yes.
It's the things that we don't know, right? So when you know better, you can
Do
do
better.
better. And this is why this community is so important.
Well, I must tell you, like my niece Belinda tells me, if you don't know, you just don't know.
You
No,
just
right.
don't know, right?
Yeah, when she says it, I have to laugh.
You just don't
Don't
know. You
know.
don't. And I didn't know. Thank you.
Yeah.
Yeah, Michelle, your pet dander too.
Yes.
Um, because I could tell when with our dog and because of my allergies with dust and stuff, I can tell when it's time to Swiffer, when we miss vacuuming, that kind of stuff. I feel it. And
Mm-hmm.
once it's done, it makes a
Mm-hmm.
big difference. Like we need to clean our AC filters.
Mm-hmm.
Yes.
And I regularly change my air filters. My AC guy said, most folks do it once a quarter, but you should really do it like every 2 months during the allergy season time.
Mhm.
Well, Miss McNear, also you could get essential oil peppermint
Yep, got
and
that.
rub your dog down, clean their feet with hydrogen peroxide when they come in, and rub their legs and feet down with the
Hmm.
essential oil peppermint. Because
Peppermint,
anything that's on them is not going to stay on them long because they can't
right.
take the peppermint smell.
Hmm.
Right.
Yeah, I
And
use peppermint I spray it around in the yard and stuff too.
oh,
Mm-hmm.
absolutely, I do too.
Mm-hmm. Wow. See, I need a whole spray gun to get this apartment complex. See, and they don't clean they mow the lawn, but they don't mow the lawn. So we have they don't nurture it, take care of anything. So we have all kind of ant piles in where we walk. So ain't no telling what's in this carpet, but I'm
Hmm.
gonna get with the carpet this tomorrow morning. But this is just, you know, I don't know, family. We still have to be vigilant
Right.
because the COVID is still here. They call it flirt. Next month it might be sexy. In the month after that, ain't no telling what, sugar cane pop to. I mean, all of these like different variants, different names. Now they trying to, I don't know why. I don't know. I don't know.
I still see a lot of people wearing their masks. And I put mine on with everything else.
I see a lot of people in the grocery stores wearing masks when I do go. I go to the grocery store. When I do go to the grocery store, I'm there like 6 o'clock in the morning because I feel like no one is going to be up shooting at 6 o'clock in the morning. Ain't no mass shooter in the grocery store at 6 o'clock in the morning. But yes, even the store employees were wearing masks. So people are everyone is not is everyone is still on a sense of kind of high alert, right? Like COVID is not in your face, but if you go out without a mask, if you go out unprotected, you have to know that you leave yourself open to getting COVID, right? But there's Plaxovid, and everybody is getting Plaxovid when they get COVID. And it's easing back the symptoms. I think I heard them say that it'll keep you out of the hospital.
Right, right. But remember, everybody can't take Plaxovid.
Plaxovid, right.
Right.
Well,
So
everybody doesn't know that they shouldn't take,
Plaxovid, or might not be able to.
Right.
So everyone doesn't know that everyone cannot take Plaxovid.
There you go.
Everyone thinks that everyone can take Plaxovid. Okay.
Right. So they don't. So there are people out there who don't feel like, oh, I don't have to be careful because there's a medication. You get it from me, or that you'll be okay because you can. There's a medication for it. Well, you maybe not. Yeah.
From what I understand is that medication has to be taken within 3 days,
That part.
or they won't give it to you. So when you have
It's
people,
5 days.
pardon me, so when you have people who don't go to the doctor initially to even be diagnosed, because I have a friend who passed away 3 months ago, and he actually felt really strong about the fact that he had allergies, and then started to get sicker and sicker, and then he went straight to pneumonia,
Oh,
and then
Mm.
he died. He was 37. He used to work for me.
Wow.
And if he had just gone to the doctor and let them test him and rule it out, um, just a simple step, so I don't know. I've come to the conclusion that I don't have the capability to save the world. How about that?
Right.
So I'm gonna work really hard of doing my best to save myself. And I'm gonna be vocal about what I know, but I'm not gonna be frustrated with people anymore who don't feel the way I feel. I want to do what I want to do. I just don't want them real close in my circle.
Mm-hmm.
Right.
I agree, Sister Shirley. I think that's where I'm at too. Like I'm comfortable at home, sitting on my deck, and when I have to go out, I can put my air tamer on. But I don't necessarily have to invite you into my space, and I don't necessarily have to be in your space either.
Right.
You know, um,
Well, that's
I
what we're learned from the pandemic how to stay at home,
Mm-hmm.
how to stay at home, how to be alone, how to figure
And
how to
right.
learn how to do other things other than running the street or going.
Let me negotiate my space,
Yeah.
spaces that I want to be in, right?
Yep. Mm-hmm.
And I used to go to church every Sunday. I don't go to church every Sunday now. Um, but my faith walk is stronger than it's ever been.
Mm-hmm.
So, it's not in the building, it's what's inside my heart, right?
Right.
Right.
Yeah.
And
So,
it's also how you share it with other people. I mean, I've been thankful about, there's a situation that I'm invested in right now, and Sister Shirley is on my prayer warrior team, and it's like that is so beautiful. It's not just what you do on Sunday, but how you pray for other people and pray for other people's circumstances, or being able to call on somebody, in the middle of the day and say, okay, this is going down. you know, can I get some prayers going up, right?
Right.
And to have, have folks doing that. And so our prayer time has changed. It's
yeah,
not just something we do a couple hours, a couple hours on Sunday. It's a part of how we live and how we live with each other, fellowship with each other.
Mm-hmm.
That's what's changed for me.
me too. Me too. Um, yeah. No one would have been able to tell me that I would take on the responsibility that I've agreed to do, and that's the fellowship Bible study, a facilitated Bible study. Because I remember when the lady said something to me, I said, listen, that's nowhere on my vision board. What are you talking about? Vision. I know God was disappointed with me with that response. I was disappointed later on when I played it back in my head how thankful I should be and
Mm-hmm.
that I can impact others. You walk around here talking about not on your vision board, girl, go get a life.
God has the ultimate for you, Shirley.
Yeah.
you know,
I felt
but
like a fool.
because you got to have to consult with God before you let anybody else put something on your vision board.
That is true. That is true. And that's exactly what I did diligently. Um, instead of trying to figure everything out on my own like I always do. I just said, I'm going to bed. Here, God, you tell me what you want me to do. Yeah.
Well, Sister Shirley.
Family, I just want to say that we all have been taking care of each other for 4 years.
Yeah.
Yeah.
Help of everyone on this group, including the late Doc Lane Roland. I have at least 3 layers of protection on every time I step out my house.
See.
And when I go to the big box store, I throw on the 4th layer with the what is the other one? We got the air tamer and the big one that costs all the $300 and something.
Oh, air cave.
Air cave that
Mm-hmm.
stays in the car. So when I go in the big box store, I add that on. So I am very thankful for everyone on this group. We share little bits of information that keep us whole.
That's true.
Now, I'm a fan of the church, but I think the church is a little dangerous place when it comes to spreading germs.
Mm-hmm.
Yeah. Yeah. So yeah, I don't have my husband, in the Catholic Church, you do the whole communion process is one where you get the host, and then there's a communal wine cup. And I told my husband that we can no longer drink from the communal wine cup. Period.
They pass it down to each person.
Yep, they still do it. Like in the Baptist church, you have your own
You have
little
your own.
But in my Catholic church, they still do the communal wine cup. You come up, you sip, and then they wipe the place where you sip, then they turn it a little bit, and the next person gets a sip. But still, you know, your lips, your saliva, your stuff is whatever. It has touched, it goes, you know, it goes inside it's in the, we can't do that.
Yeah. Yeah.
I
That's
just
why
told
I
him,
always wanted to be the
"Hey,
first one. That's why I always wanted to be the first one to have the first surgery. Because I figured I would get the sterile and then all the last sterilization would happen after the first.
I want to be the first one. You got that 5 o'clock spot? I understand. I'll be saying the same thing. I want to get in quick because I don't want staff.
Yeah.
Okay. Ooh, we think alike, Sister Shirley. I don't know what to do without you. When you
Well,
come,
listen, I want to mess y'all up. They might not clean the night before, so
yeah, no, they cleaned that. They made sure just in case
they're supposed to clean it in
just
between
in
both us.
case J. Cole come in, they gonna make sure that that's right for the first one because J. Cole can just show up.
Come on, don't skin. They gotta do it for everyone now, y'all.
Just show up. J. Cole will just show up.
I thought about that when I had my colonoscopy because I know how they clean those scopes, and I'm like, I want mine. I want to go first.
Yep, I'm gonna go first. Yep.
No,
Yeah.
not second. Am I second now? Tomorrow? The next week.
You plan your appointments based on, can I get the first 5:30?
Then the other thing is they're fresh. They are fresh.
They are fresh.
Waking,
right,
more conscious as the day go by. They get sloppy.
Come on, like a nail tech. You be like, wait a minute, you didn't polish. I started the line. By 12, they polishing outside of the line. They ain't polishing inside like 9.
Right.
Okay. Yes. I love my community. I love y'all. Auset-Isis. I love this place.
Sister Shirley.
Sister Shirley, we are going to miss you tremendously.
I'm gonna miss you guys too. You know, it's like,
when you coming back, girl? When is it over? How long you got to do it?
actually, I go from September to May.
Ooh, that's a long time.
Yes,
September that's coming up, right?
Yes,
Okay, so we got a couple of more months.
September. Yeah.
Okay. That's
See,
all right.
Sister Shirley, your friend is stuck in my head. The one that knows she's got COVID and she's walking around on the plane to the funeral.
She ain't the only one, Sister
She's
Bell.
not the only
She
one.
ain't the only one.
She's not the only one. That's why
won.
I have my layers of protection on when I go out in any.
Exactly. Because it's folks like them.
That's right.
So I couldn't even respond to her, like text her back when she said that to me. I said to myself when I got off the phone, Lord, forgive me. This bitch is still crazy. She's still crazy. I need to put her right back in the bucket that I had put her.
Right in the box. Like, girl, I accept your apology, but you going back in the jar.
Yep, she's still crazy.
You know, it's just be like some friends that you just, you know what?
They don't deserve us. You know, we don't deserve them. Any way you make, you know, any kind of way you want to look at it. But and if I tried to have that discussion with her, she would just go, you know, scripture.
There you go again. Yep.
Oh, scripture by scripture. You know, that's how she got me before. You know, well, you know, God this and holy this and you know, and I don't believe in you know, like I see, well, I had a whole party and girl, you know, that wasn't you, that was God. I said, but I didn't say it was me. It was the knowledge that God had given to me that made me care enough about everybody else. I mean, no matter what I said, she wanted to water it down.
Well, Miss Shirley, that don't sound right because she's the one talking about God, but yeah, she going on the plane or whatever she's doing, knowing she's sick.
Isn't that what people do all
whatever
the time?
works for you. Yeah, whatever works for you. That's what they do.
Yeah.
I mean, they use, you know, it's interesting how they can just take their understanding of God, you know, and apply it to everything in their lives but the fact, I guess the one thing I don't understand is God gave us a brain to use and to think. He gave us hands, eyes, ears, and if you have all of your faculty, then you need to use it to glorify God. Now, what does that mean? Right? Well, that means that you have enough knowledge and enough sense to understand that a virus can spread and that it needs a host and that you can spread this virus to people and you can kill them. You know, and that's common sense. That's God gave us common sense. And if you don't use common sense, but you take scriptures to validate you not using common sense, that's what bothers me. And I'm glad that I was able to get that part out because I can get lost in that. It's
You
late.
said it well.
I'm sorry.
You said it very well.
Oh, thank you. Yeah, I mean, come on, let's do some common sense, right? And so we get caught up in, oh, Jesus will heal and Jesus will this, but Jesus will allow you to die because you didn't use common sense. And and we have had a lot of people in our community to die. You know, some we know, some we don't. Some they tell, most they don't. We have a lot of people in our community who are suffering from long COVID, and they don't even realize that they have long COVID. Or maybe they do realize they have long COVID. Maybe they still have access to all the right medical treatment. You know, maybe they do have long COVID, accepted it, and now they are in a program and they're getting the access. But do you really want to live like that? Like, I don't want long COVID. I don't want COVID. I don't want any of it. And I try my best to make sure that I stay safe and that I can keep my family safe as much as I can because everybody has to use their own common sense too. Next week.
Wait a minute, before we go into next week, someone, Sharon C.
Oh, Sister Sharon?
Yeah, she asked, how do you know if you can't take Paxlovid? I did answer it in the chat. Basically, the issue around whether you can take Paxlovid or not is based upon if you have any kind of chronic diseases where you are taking any kind of medication, you should make sure you let your doctor know what medications you are on so they can check for any specific drug interactions. I can't make a blanket statement about this group of people can't take it versus that group of people. It's mostly about whatever drugs you're already, medications you're already on, and making sure that there won't be any drug interactions. Even if you are on a specific medication, it may not necessarily mean that you can't take Paxlovid. For some medications, you can be off of them for a few days, or your doctor may instruct you to cut the dosage level while you're taking Paxlovid. And then there are some people, I don't know, depending on what the medications is, there'll be some people who won't be able to take Paxlovid at all. But that's a discussion to have with your doctor, particularly if you are taking any kind of medications. So.
Yeah, I was just wondering because I didn't know if it had something to do with, it makes some people sick or whatever. But I'm like you, I don't take any medicine either. I just was just wondering about that. And are y'all still going to I think, didn't you say you work with a personal trainer, Dr. Blessman?
I do.
Are you still going to the gym?
Yes, I am. Yeah, I was at the gym today. Yeah. It's hard to feel weak when you're strength training.
But you feel comfortable, I guess, with all the air, because now it's the summertime, so everybody's going up in the gym and it's all hot and sweaty in there. And
okay, usually, first of all, I take my Iron Me, and I also swab the inside of my nose with Skin Guard, and I use my Skin Guard on my hands. Yeah. Usually in my gym, there's only it's not really crowded. I don't go during the crowded times of the day. Like Saturday mornings at 9 o'clock or 10 o'clock, it's very crowded. Meaning when I say crowded, that means for our gym, that means there'll be more than 5 or 6 people in there. I'm usually in there when there's only like less than 3. me, the trainer, and maybe one other person, maybe 4 people altogether. But if there's 5,
you said the skin guard and the iron.
I have the Iron Me, which is like an ionizer, but it's
square box.
It's a little square box, and it's supposed to be for a 100 square feet, but I don't. I have it near me.
How do you spell it?
ION capital MI. Hold tight, and I will get one and show it to you.
You can buy it on Amazon.
I thought I had mine.
You can buy it on Amazon.
Oh, it's in the book. Me.
I think it's 500.
Spell it in the chat. Miss Sharon, there it is.
It looks like.
Okay.
And you can buy it from. I have my sticker on it. But you can buy it from Amazon, and it's a little thing. It's like a 1.5 by 2 inches little box.
Oh, yeah. Would you just keep it close to you?
So if I'm on them, if I'm on a machine or whatever, I just keep it close to me. Because if I'm working out and I can't, the ionizer, it'll be flopping up and down if I'm doing jacks or if I'm doing pedal ball swings or whatever. So, but I just have this, it pretty much in the area in which I'm working, and I always swap the inside of my nose. So that's another thing, and that's pretty safe. I mean, that's, you don't have to worry about that. And so that's what I do with the gym. And of course I have the skin guard on my hands. So I don't, so I'm not,
Okay.
I'm not.
And so for me, I put the skin guard on my face.
That's another good one too.
Skin guard on
what I do.
Especially when I'm traveling on the plane. Yeah.
Right.
Absolutely.
And tell her she can plug it in her computer too if she's at work or wherever, she can plug that in.
I'm sorry, say that again.
Tell her she can plug that in if she's working in the office. If she has a computer, she can plug that into her computer as well.
Oh yeah, that's true, because it has a little
USB.
I don't know if that USB.
Okay. Right.
So if you're in your office, you could have it in your, have it as an air purifier next to your computer in your office.
Yeah. Well, I just started my new job April 1st. And I'm not gonna say where I work, but I'm in Houston in the medical center. So I'm around doctors all day. So when you're saying it seems like people are just not paying attention, well, the medical community is I guess who we look to. I mean, we don't have to do, we have our own brain. But if they look comfortable walking around with no mask and they're in the hospitals all day, then that's what everybody else is going to do.
Right.
Yep.
And I'm around them all day and they're not wearing masks, so it's like everybody just feels comfortable not wearing a mask. And this is in the Texas Medical Center.
Yep. And they look at you crazy when you have yours on.
But that's peer pressure.
Exactly. But Houston has always been like that, because even the governor was not endorsing people to wear masks when everybody else was. But I still don't think that that's a reason for us to not care enough for ourselves.
Right.
What they do.
You have to think for yourself. But I have noticed doctors eat healthier than like from where I came from. I've noticed, when they order food for these doctors, it's healthy. Doctors eat healthy. I have noticed that. So I've been doing that, but I have not been as mindful about, protecting myself.
You don't wear your
And that's
air
why,
tamer, Miss Sharon?
no,
Oh,
Girl, wear your air
we
tamer.
we work in the office. I work in the office every day because I'm on probation. But everybody else, once the probation is over, you work from home 3 days and 2 days in the office.
Mhm.
So the office is not crowded. And then we have our own little personal, spaces where we can close our doors.
Mhm.
But it's just, everybody's just relaxed. So, but that's why I come every week just to keep it on my mind and be mindful.
Yeah, because that could be to a fault too, right? Because we
Yeah.
can't get, I mean, the thing is that there's a lot of speculation, and and I'm sure Mr. Eddie has some good insight. Probably should have had him come come into this conversation a little way
A little
back.
sooner.
Yeah, but the one of the things that we did as a community, especially Eddie, around the guy that I can really appreciate is he even explored the doubling of mutations, right? Now it's happening. It's in the now. One of the things that we were working with when it wasn't double up, there was, I think, as we were doing the creation of the senior guide, the strands were doubling up, but now we have like cross doubles, and they come up with a new variant that's called flirt. So if we're not vigilant, if we're not, looking at this information, um, if we just stop researching, then we don't know what's actually coming and what's actually out there. That's just bottom line, right? So it's important that we still have these conversations, even though we're talking about healthy eating, um, and
and keeping our
making
body
healthy,
healthy.
right, in our body, and making sure our bodies can withstand an attack if it happens, right? So, but one thing that we cannot not let go is there's no cure for COVID.
That part.
There's treatment. There's
That
no
part.
cure for COVID. And as much as they want to say Plaxeville is more like a cure, there's no cure for
It's a
COVID.
treatment.
It's a treatment, right? And
Which may or may
now,
not work, because they talked about rebound.
right,
There are people who took Paxlovid and it reduced the symptoms, and then as soon as they stop,
It's just to treat the symptoms. It's not to cure.
right. It's not a
they're not
cure.
cured.
It's
Yeah.
not, there's no cure for COVID.
Right.
So our air is full of virus. The birds are sick. They have the bird flu. The bird flu has jumped to cows, right?
Right. So
There
it's a
has
matter of
been a
time
big
before it jumps to humans. Remember,
it, it and that's the piece. That's why you stay vigilant, because when it jumps to humans, now we really have a problem.
mhm. And it's in
Um,
our guide, the bird
mhm.
flu,
The
as a
bird flu,
variant of concern. Yeah.
uh-huh. And I post that on Facebook. Like it's out here. If you want to know, we talked about it. We talked about what is happening right now. Right now, we couldn't go 2 years into the future, because we don't know, but there's no cure for COVID. So COVID is still running around, um, mutating, virating, and trying to continue to stay alive, even in the midst of vaccines. So that's how serious this thing is, right? Like we be like, I don't even know. This thing is like living through like 4 or 5 different iterations of a vaccine. It should have been gone. but that's not how this thing is working. And so
Right.
we still need to be skin guard up, get your air tamer, Miss Sharon,
Right.
get your air tamer,
Put it on.
put it on, and let
Mm-hmm.
them folks ask you, well, what's that? And then
Mm-hmm.
you can
Mm-hmm.
educate them. Right now, funny, I've been wearing my air tamer a long time. And so my family is used to me having my gadget on my self persons. And no one asked me what it was at the graduation celebration. So they checked out. Right. They have checked out. And I'm like, Miss Shirley, I don't have nothing to say because I have nothing to say to you all any longer. Now when things change, and if they change for the worse, then they know who to come to, right? To find out how bad is the problem. Um, Death has not changed people's behavior. And I think that's the thing that is sobering for me is we've had a lot of death in our family and friends circle, but it wasn't enough death to change behavior.
Wow. Wow.
Um, next week, because I know we have went to 9 o'clock, and thank you because we needed just this time with each other. Next week is holiday, and it's the Memorial Day weekend, so we're gonna take our holiday break. Happy Memorial Day, and then we'll come back the following Tuesday.
Okay.
Any questions? Anybody? Yes, Miss Shirley. Yes, Miss Shirley.
I have a question.
Yes, Miss Belvedere. I thought that was Miss Shirley. Yes, Miss Belvedere.
Hey, I have a question. I really is not a question. I wanted to chime into Dr. Blessman when she was talking about the Paxlovid and ask your doctor. The better person to ask if you can take the Paxlovid is your pharmacist.
That's true.
The one that fulfills all your prescriptions is
Prescriptions.
the one to ask if it's safe for you to take before anything happens.
That's true.
Yeah,
That's a good.
Yeah.
Perfect.
You
You're
told us
absolutely
that. You
correct.
told us that a few years ago when it first came out.
Oh yeah, your
And I get
pharmacist.
it. Yeah.
Right. Because they have that. They have a computer. They have access to a computer program that will immediately spit out what the interactions are. Yeah.
Yes.
And they know what meds you're on. They can see the meds you're on. Huh?
Of course.
Right.
Yeah. So you're
Yeah.
you're a personal pharmacist.
Your
Right.
doctor does too. They
Good
have
point.
EMRs. You know what's interesting with
Checking.
your primary care physician is they will have those same alerts and will bypass them just to put you on. Oh, it's not that much of a side effect. I'm like, well, didn't it
Tell
say
her, Michelle. Come on, tell the truth.
they're gonna die? You gonna order it anyway?
Yeah,
So
because if you're taking a statin, is one of the main reasons why the Paxlovid is not good for you.
right. And I take a statin.
So but I'm gonna tell you the pharmacists don't care one way or another. They tell you the truth. The primary care, sometimes he acts a little dilly about it and
Right.
gives you misinformation.
Well, they get a
Right.
kickback from the pharmaceutical company,
Of course.
or
Whatever. And you just want to be sure. I mean, if you already know, like my husband's on the statin, I don't really want him taking Paxlovid. So to me, the best route is for him to stay safe and not catch COVID, period,
at all. Right.
at all.
I
Okay.
believe in an ounce of prevention and not a pound of cure.
And not a
There you
pound of
go.
cure. Hello.
Absolutely.
Well, I
Absolutely.
want to share something with y'all. My mom I had to go, I had to ride the ambulance. I had all my gear on my mom on Saturday because she had to be rushed to the hospital. And I have to say, this particular hospital in Atlanta, Wells Store, the ambulance people had a mask on. We got into her room, and the nurse had it, the doctor had it. I was like, okay, what's going on? Because you're not used to seeing doctors and staff wearing it, but they had their mask on. And I was really grateful to see that.
I'm
I want to
connected
share
to
that.
the hospital executive of WellStar on LinkedIn, a Black woman, and she ain't no joke. So I can see her, encouraging her staff to wear masks.
It's good.
Mm-hmm.
And getting back to the doctors, I will say this, sometimes the doctors don't know, they don't check the medication, they don't take the time to do it, or they're giving you stuff you don't need. My mom was prescribed something for a UTI that her primary care doctor said she had, and then which was just a few days ago. And when she went to the ER, they tested everything because we thought she was having a UTI because she had bad pain in the back and in her stomach and all this. And they said she does not have UTI. Do not take the medicine. But the funny thing about it, I was saying, Mom, you need to take the medicine. And she said, nope, I ain't taking it. And I'm just saying, shit, the Holy Spirit told me don't take it. Well, when they told her that, she said, I told you that's why I didn't take it. Something told me don't take the medicine. She never but the next told her that, ma'am, don't take the medicine. You don't have a UTI. We're going to double check and we'll call you in 2 days. And if we call you, which we doubt that we're going to call you, don't take it. So it's unfortunate how one doctor will say one thing, another will say another. I mean, well, what is it? So it's really bad.
You can't diagnose. You can't always diagnose at a primary care physician's office. Usually they will want to do, say, some kind of MRI to see what's going on with your back. That's an educated medical guess.
Mm-hmm.
And then you're not right.
Well, some health coverage don't even want to give you the MRI. You got to do this and that before you can get it. And I'll give you the step. But I was having some back pain. I really haven't talked about it, but I've been having back pain for a while. I got an X-ray and it showed I had some changes on the lumbar. And then the doctor ordered an MRI. Then someone approved it, and the health coverage came back and said, "No, we can't do this. We're not doing the MRI. It's not warranted." I was like, "Wow, so I can have something going on, but we can't do an MRI." Yeah. So it's just amazing how they terminate, they deny something for whatever reason because they don't want to spend the money.
And see, that's what we have to be.
So I was fussing with back and forth on the phone, and I'm still fighting with them.
Those are the changes that we're going to feel. Yeah, so those are the changes that we're going to feel in our own personal health care benefit allotments. This is not, everyone wants to, you want to say take on personal responsibility, you want to do the right thing. People that don't do the right thing, they're overwhelming the healthcare system. The healthcare companies took on a vast amount of the care, for free because it was COVID. But they are in business. See, that's the thing I had to come to terms with my termination too, right? Because I'm like, heal the people, do the people right. They're like, yeah, girl, get out of here. It's business. So when you get to care, closing care gaps and, all that sounds good. But at the end of the day, it's business. And if we don't have some kind of universal health care in this country to put a cap on what these insurance companies are doing, then we're going to be in a world of trouble because this COVID pandemic is going to come back and bite us in different ways. We'll have less coverage and we'll be paying more in premiums. We'll have less access and we'll be paying more in deductibles, less access, and we'll be paying more in a copay. And then once that has been, people have gotten used to less services, right? Then they will change the service that you get. It's already less, but it'll change where you can only have an annual visit.
Right.
And you have to watch out for these, and you're like, oh, Michelle, girl, my mortgage, my car note, watch for what? This is what we have you for. Okay, this is how these things will change. And so we definitely have to be engaged in the political process to some extent, right? So
Right.
I ain't gonna tell you who to vote for, but vote. Because if we don't get the right administration in office this second time around, then it's gonna be worse than we've ever seen it before in our lives. And we can forget about healthcare. You better be trying to figure out, are you safe being Black in this country? That's where I believe we are. So, but we're not all the way there yet. We have to still advocate for ourselves on a level so that we will overcome, not only thrive but overcome what's coming, because it's some more stuff out there. The cows are sick, the birds are sick. You should not be drinking the milk. They said that you can cook the milk to get the bird flu out of the milk, but you should not be drinking milk.
Those
That's what they give our kids in school. That's all they get: milk for breakfast, milk for lunch.
Uh-huh.
Well, you have to educate your children.
Right. I'll be telling my children, don't drink the milk.
Yeah, vegans are vegans for a reason.
Don't drink that milk.
Yeah,
Little Johnny, don't drink the milk. I told my grandkids, don't drink that milk.
And it's funny. It's so sad.
Yeah, don't drink the milk. Why? It's spoiled. Until I see something different. I haven't seen anything different, so don't drink the milk. Tell your family, don't drink the milk.
But you must tell them why, because if you say don't drink the milk,
bird flu. Yeah. Oh yeah, I should always shit.
you have to give them the why.
The milk is sick. The milk got COVID. Yeah, bring it down to the baby's level. Milk got COVID, Grandma? Yep, because the cow got COVID.
Can I share a little quick story with you?
Yes, please.
I lived upstate New York. There was a farm right next to my house. And I took the little kids from the city on a tour of the farm. And the guy says, the kid said, well, what are these big machines for? They said, well, this is where the milk comes through, and they process the milk, clean the milk, and then it has to go to the grocery store. So he also shared with us that there's only one bull in the county, and they rent this bull from farm to farm to farm to farm, which is in our language called promiscuity. So they have to give the cows antibiotics because they're going to spread syphilis from farm to farm to farm, from cow to cow to cow. That's what the reason for the antibiotics are for. So without a pregnant cow, there's no milk in the grocery store. So it's a vicious cycle about the antibiotics and why they have to give it to them. Because that one bull goes from your farm to my farm, to Blessman's farm, to Renee's farm, to Miss Shirley's farm, to Patricia's farm. And he is spreading, getting all of the female cows pregnant so they can sell the milk in the store and the cheese. So that's why we have antibiotics, and we have an immunity built up against antibiotics from when we get sick. So
why can't nobody buy another bull?
They won't. I don't know why. I don't know why, but this only one. That man educated me that day. That was so many years ago. And this is not just here. This is everywhere.
Everywhere.
One bull goes from every 2 weeks. He's at a different farm.
Ugh.
Syphilis is an animal disease. Syphilis has never been a human disease. That we got it from the animals, from eating and drinking the milk and eating the beef. So now they load the cows up with antibiotics so he can't spread syphilis. So this is kind of late. That he can't spread the syphilis and we don't get it.
Good God Almighty! See there you go, and the syphilis is running around.
We got it.
Syphilis is a pandemic now, you know that.
But I don't eat beef. I don't eat meat. I don't. When I left my mother's house, I said, when I grow up, I am not eating that horrible meat. I just never liked it, and I didn't know this then, but I do know it now.
Shame. Well, I'm slowly turning around. Yay.
And I told you that so that you, when you feel that the thing with the bird flu is over, you can go back to eating your meat. Leave that meat alone. You can survive without meat.
You don't necessarily have to have.
You don't have to have beef.
No, you do not. Nope. Nope, you don't. And
And
I'm
Dr.
learning that.
Leslie, I didn't forget to ask you about your soursop bitters.
Oh, yes, you are so right. I took it in, swirled it around for 30 seconds. The first day was hellacious. Second day it was better. Now it's fine. I
What I
swirled it
tell
around for 30 seconds and and I'm good. I have it works. It works.
You are cleansing your blood.
So, what can I say? Thank you very much for that
My
tip,
pleasure.
because it really works. It really works. I mean, yeah, if you can get through the first day, because I did it in the morning, then I did it at night. But the second day in the morning, it was like, okay, I got this. Let's just go on and chug it up.
Yes.
And swirl. And it's something, maybe it's about swirling it around for 30 seconds, but I like, I'm counting,
Yeah.
And definitely by the fifth time, by the third day, the fifth time, it was nothing. It was a breeze. And then there was a couple of days that I went out of town and I didn't take the soursop with me. And I thought, okay, so is it going to be horrible when I get back to doing this? But it wasn't. It wasn't. So even when I took a few days off and came back to doing the soursop morning and night, it still wasn't, it wasn't crazy bad. Now I do, have some water afterwards to kind of refresh my mouth afterwards, but it's good.
Well, I'm so glad I got you through that because I'm on my second bottle.
All right. All right now. Okay.
Yeah. And I'm feeling wonderful.
Amazon to get me a bottle.
Mm-hmm. Absolutely.
Okay.
So it's 9:09. Let's,
Yes, it's late.
I mean, I love all of you, and we could probably be here till 10, 11, but we need to get to work. Michelle needs to, do her thing, and yeah. But let's call it a night. And I love all of you, each and every single one of you.
Love you more.
Love you more.
I don't know about that, but okay. But our goal, we want people to thrive, not just survive, and in life in general. And yeah, go forward and live robust, fulfilling, meaningful, purposeful lives. Okay. You gonna see us out, Michelle? Are we gonna have our
Yeah,
usual
it's loud.
right?
It's loud, so give me a minute.
Okay. Living water. Yes. Our song. Good night, Patricia from London.
Good night.
Good night, everybody. Have a safe holiday.
Good night.
We'll put up a sign next week just to make sure that people that we're taking a break so that people know.
Okay, I'll miss you guys, but have a wonderful holiday.
Yes. Be safe.
Good night, everyone.
Safely. Oh.